Having put a stop to your gallop on this particular matter the other evening, Deputy, I'm happy to see that we've been able to select it today. Mr. Naughton, are you dealing with this matter? You are.
Minister, yesterday a document was released to me under Freedom of Information from the National Treatment Purchase Fund. The document was released to me in an email which was issued to nursing homes by the contract manager of the NTPF to nursing homes shortly before 10 a.m. on the 12th of March 2020. Now, I've already furnished the Minister for State with a copy of this email, and the email states, and I quote, "The NPTF has been asked to establish capacity within the nursing home sector." It goes on to say, and I quote, "Nursing homes will need to have the ability to care for patients coming from the acute hospital setting, and facilities must be able to facilitate short-term residents being discharged from an acute hospital. Residents may be nominated by the HSE and the Department of Health as applicable for receipt of appropriate funding." Describing what will happen, the letter says, the individual facility will coordinate directly with the discharge unit within the hospital. Minister, this is a damning document. In many ways, it is the smoking gun. We know that the COVID-19 nursing home expert panel found that 10,000 patients were discharged from hospitals into nursing homes in the first 6 months of 2020. Now, was it a government decision to move elderly patients wholesale out of hospital beds and cram them into nursing homes? The major question here is, who instructed the NTPF to issue this email? The email says that they were asked to establish capacity. Who asked them, Minister? That's the first question. Also, we learned that there was a pot of money offered to nursing homes in this time. How much was offered to get older people out of hospitals? The context of this discussion is pivotal at Count Corlia. In early March, nursing homes voluntarily closed their doors to visitors in an attempt to protect the vulnerable residents. On the 10th of March, Dr. Houlihan, the CMO, issued a statement saying that these restrictions were, and I quote, "not necessary." Now, what this document shows is that 2 days after telling nursing homes to reopen their doors, an email issued to nursing homes instructing them to make way for a large influx of patients from hospitals. Now, further FOI documents released reveal that throughout all of this, the Minister for Health, Simon Harris at the time, was repeatedly ignoring requests for meetings with the CEO of Nursing Home Ireland, Tig Daly. The opposition spokesperson at the time was Stephen Donnelly, and he's revealed that the HSE, and I quote Stephen Donnelly, he said, intercepted supplies of oxygen, PPE, and staff that were meant for nursing homes. So was there a concerted effort by the government or the HSE to take older people out of the safety of hospitals and cram them into nursing homes during the pandemic? And how could this decision be made when the minister in charge was ignoring appeals from the sector to meet with him, and when nursing homes were having their PPE, oxygen, and staff taken from them by the HSE, and when the CMO was telling nursing homes to keep their doors open, wide open to the public? Minister, these are an incredible set of events at a period of time where this country was being influxed by COVID-19. And remember, in all the conversations we have here about COVID, the majority of people died with COVID in a nursing home or a hospital. 2 locations, either owned or under the regulation of this government. Minister, can you answer these questions, please?
Thank you, Count Corla, and thank you, Deputy. And I just want to say at the outset, Minister of State Mary Butler was due to take this question today, Deputy, but due to the change in time of topical issues, she's in the Shannon at the moment bringing legislation through there, so just her apologies in relation to her not being here for this. The COVID-19 pandemic has led to an unprecedented challenge across our health services, and none more so than in our nursing homes. The National Public Health Emergency Team, the Department, the HSE and HIQA placed a focus on supporting older people in nursing homes throughout the pandemic. Quality care and patient safety is a priority, and our continued focus is and will always be to deliver safe and high-quality services. From the start of the pandemic, the HSE, through the Health Protection Surveillance Centre, has developed an extensive body of guidance and support tools to assist in the management of COVID-19 cases, including in relation to decisions on transfer of patients and residents between care facilities where appropriate. The decision to discharge patients from hospitals to nursing home settings is always subject to clinical assessment. The discharges to nursing homes and other settings are a regular daily feature of a functioning health system. The period from early March 2020 to mid-April 2020 saw an increase in the number of such discharged patients as the health system prepared itself for an expected surge in COVID-19 cases. From an older person's perspective, being admitted for longer than necessary increases the risk of a patient contracting a healthcare-associated infection or deconditioning. The vast majority of these discharges took place from March the 10th, 2020 onwards, when clear public health guidance was in place across all acute hospitals. On the 10th of March 2020, the HSE issued interim guidance on transfer between care facilities, which included preliminary guidance on the transfer of hospitalised patients from an acute hospital to a residential care facility in the context of the pandemic. This guidance was circulated to all acute hospitals, community healthcare organisations and residential care facilities accepting admissions of residents. In order to ensure sufficient acute hospital capacity to manage the anticipated surge in hospitals, emergency funding was made available to ensure patients who were clinically stable and appropriate for transfer could have their discharge facilitated while adhering to the guidance. There was also an emphasis on ensuring that those patients who had completed their acute medical treatment should be prioritised for such transfers, either to residential care or with some home support, so as to avoid their exposure to the anticipated surge and prevent hospital-acquired COVID-19. The protocol set out in the guidance, along with infection prevention and control advice and supports, were put in place to assist the nursing home sector with a view to mitigating the level of risk and transfer of COVID-19. It must be recognised that the pandemic has not concluded, and at this time a priority focus of government remains on the ongoing management of COVID-19 and our response to that, to ensure that the positive gains now being experienced and preserved, and that those most vulnerable to the virus continue to be safeguarded in the light of residual risk. The Department is continuing to look at options which may be available to the state in relation to listening to the voices of those who have lost a loved one. And I would like to conclude by expressing my sincere condolences to those who have lost a loved one during this really difficult time.
Thank you, Minister Naughton. Deputy Toibin.
Minister, in fairness, none of the questions that I've asked about accountability have been addressed by yourself whatsoever. And this is a serious problem. We need to get clarification with regards who was behind these particular decisions. You mentioned that HSE was provided to the nursing homes. That's not exactly true. So further FOI's documents that I've received show that on the 19th of October 2020, your colleague, Minister for Older Persons and Mental Health, Mary Butler, wrote to the CEO of the HSE, Paul Reid, seeking assurances that the HSE would continue to provide staffing supports to homes. Paul Reid didn't respond to Minister Butler for a full month, and when he did, he said that all was well, that the HSE would continue to provide funding for nursing home staffing and support for the nursing homes. On the 16th of October 2020, a similar letter was sent to Phelim Quinn, the CEO of HIQA, and I quote again, Paul Reid said, "I am disappointed that you state that certain private nursing homes have not reported that we have supported from the HSE." So during this time, well, Mr. Reid was telling both HIQA and the Minister that all was well. I had nursing homes on the phones to me literally crying for staff. And I'm thinking specifically of a case in your own county, Minister, the county of Galway, which occurred almost at the same time that these letters were issued, whereby a nursing home, bar 2 staff, tested positive and were left without any support, resulting on the 2 staff that were negative unable to leave that nursing home because there was no replacement staff. That's an incredible situation. The headlines in the newspapers at the time, Minister, in case you didn't notice, were screaming staff shortages in nursing homes. And all the while, there was 75,000 people who had applied to be on call for Ireland, and they were pretty much left untouched. And you mentioned about people being discharged under normal regulations. People were being discharged from these hospitals into the nursing homes without being tested, Minister.
Deputy.
It was an incredible situation. When will there be a full investigation? When will there be accountability? And when can we be sure that this won't happen again?
Minister Naughton, please.
Thank you, Deputy. The pandemic has been a hugely difficult time for all of the residents, relatives and staff of our nursing homes. As the House will be aware, the COVID-19 nursing home expert panel established last year provided a comprehensive report and package of recommendations in relation to both the ongoing response to COVID-19 and the longer-term strategic reform of older persons' care. Many of the short and the medium-term recommendations of the COVID-19 nursing home expert panel report have already been implemented. A number of these relate to the delivery of a broad suite of supports provided to private nursing homes, including free PPE, serial testing, HSE COVID-19 response teams, IPC training and temporary accommodation for staff. Continued learning and understanding of progression of the disease in Ireland is an integral part of those recommendations. There's been significant and ongoing consideration of the impact of the pandemic, with various examinations and developments of reports with a focus on COVID-19, its impact on nursing homes and the pandemic learnings that can inform future policy, regulation and the model of care for older people. There has been a very clear national commitment to continue to learn from the pandemic as the national and international understandings of the virus evolves, and where necessary to ensure that the public health-led approach evolves as evidence and learning materialises. Findings of these reports confirm that the very infectious nature of COVID-19 makes it difficult to prevent and control in residential care settings. In conclusion, I look forward to supporting the significant work which is in train to further improve older persons' services.
Thank you very much, Minister Naughton. And finally,